Trott, and CEO of the Queensland Alliance for Mental Health, and we gave a great presentation this morning about providing mental health service out in the bush and how it's really important to connect with the individual groups in the community to find out exactly what they want from service in their areas.
What were the main, that was on remote and regional areas, give us a couple of the big issues around the NDIS rolling out there.
Service providers, whether or not they can maintain services under the current pricing models in those regional areas, and if they're removed then no one can get support at all. And removing stigma, it's really hard to go into those areas and not be known to the provider if it's someone local, and for everyone to see you going and getting help, and removing the stigma around that so people will seek the support they need.
Fantastic, thank you very much.
Hi, I'm Jack Wybrow from the Queensland Alliance for Mental Health. I'm the Director of Partnerships and Engagement. I'm just making that up as I go. My biggest takeaway so far, I suppose, is around continuing to be brave and have conversations around NDIS and how that fits with the mental health sector, and to be brave as a collaborative. We really need to tackle these issues together, and even though we're in a competitive market now with NDIS, it's a great time for us to collectively voice around what the community needs.
Fantastic, and happy birthday.
Thank you.
Hi, my name is Viv Kassan and I'm here as a consumer representative from the Brisbane North Primary Health Network. My takeaway so far has probably been from Pat McGorry's speech, where he spoke about needing to hear the consumer and carer voice and how important that is as we continue to develop our services, and also the comment that he made around collaboration isn't integration, which I thought was a really good point, and how we need to be dropping this level of competitiveness between services and working together more genuinely to make sure that no one is falling through the gap.
Could you give an example of that, where that integration is so important?
It's very hard as a consumer trying to navigate through the services, and quite often it's too easy to not know where to go and how to appropriately access a service, so it's easier to fall away. Where there are services that have a genuine integration or a referral pathway, handover protocol where a person can easily transfer from one service to another service, it makes it less likely and that they're going to fall through the gap and they're going to be able to access the service that they need.
Fantastic, thank you.
You're welcome.
And our final vox pop.
Okay, hi, I'm Steve. I'm from CentreCare FNQ, mental health up in Cairns. So what have I taken away today? I think mainly my interest is the transition from state funding to the NDIS, and noticing the people that are falling through the gaps. So I've been to a few talks from consumers that some have fallen through the gaps and some have not fallen through the gaps, and the difference between the two people are very negligible. So it's about education of the people that sort of provide the plans. So it's two-pronged. So one is like, how can we stop people from falling through the gaps, and how can we also educate the people so the people don't fall through the gaps? So it's kind of that space I'm into at the moment.
Fantastic, thank you very much.